Welcome to the OrthoPAC podcast with your hosts Sam Dyer, Chuck Dowell, and Miles Gilbreth. Please join us as we attempt to fill in the gaps between education, current events, and real-world practice. Listeners, today we welcome back Amanda Ben-Simon for further discussion on PA fellowships and business and leadership questions.
Amanda, how did you position yourself to go into leadership, and what advice would you have for PAs out there that are interested in doing so?
Admittedly, when I came out of school, I had no idea that PAs could be in leadership roles or that there was any type of healthcare administration degrees or specialties in this world. And then I attended APP's executive leadership conference during COVID when working in orthopedic surgery in total joints, which was elective. We were all sitting on our hands. And we're not very good at that. So I figured I might as well get some CME while I don't have any patients and the world is closed down. And after watching that conference virtually, I was bitten by the leadership bug. I was a bit upset with myself for not knowing that these positions exist. How could I have never thought of this? Of course, there are PAs in leadership positions within hospitals. Come to find out, it's rare, but it happens, and it depends a lot on the mentality of the healthcare system. But if you find yourself looking for outlets outside of direct patient care, and you find yourself thinking about the bigger picture of your department and taking on projects because it stimulates your mind, or if you want to find ways to, quite frankly, climb the ladder outside of direct patient care, I think leadership is a really great avenue for it. One of the salient points from the Executive Leadership Conference, ELC, that I took home was if you want to be a leader, you have to do the job before you have the title. So after that conference, I took on every mini project that I could, and I enjoyed every moment of it possible because I started to realize I was helping patients in a bigger way just by looking over the paperwork that we gave to our post-op patients and making sure that it's cohesive and easy to read and updated, because our protocols were constantly changing in the clinic, or leading education seminars for the medical assistants and teaching them how to properly remove sutures or take down a dressing. Little things like that will situate you in the eyes of those around you as a leader. And before you know it, when opportunities arise, your name is going to come up as somebody who always raises their hand, is engaged with the department as a whole, has interest in operations and workflow efficiencies. For me, it really started with Epic. I found myself enjoying the program and enjoying how to learn it and make as many tips and tricks as possible so that my note writing was both skilled and thorough, but also fast. And then I entered the dark side and became a physician builder in Epic and really learned kind of the back end coding of things and just how much depth comes with that program. And just by showcasing that knowledge and helping the providers around me, including the physicians, the nurses, the MOAs, it doesn't matter, we're all using the same EMR, teaching them how to use that EMR effectively made me look like a genius in their eyes. And before I knew it, other people from different departments were reaching out to me, and then I was giving seminars, and it really blossomed from there. So do the work first. The title will come.
I think that's really salient advice. A couple of those opportunities have presented themselves, and I kind of let this one drop off for a minute, but I had talked about just we use Athena, and so becoming an Athena super user to be able to help build things like text macros, procedure documentations, trying to keep that for providers, right? But, I also heard what you said, and it scared me that I could have every other assistant in the practice coming for advice. And so I guess I just need to swallow that.
Yeah, if you want to truly go into leadership, a lot of people are going to be coming to you. I've been referred to as a walking handbook before, which I think is very true.
That's great. That's a really high praise.
It is. And I find satisfaction in leadership in that I'm still contributing to patient care in a wider spectrum, I'm also largely supporting my fellow PAs and APRNs, and then they trickle down into more efficient patient care. So I love leadership and being in that unique position to operationalize changes that actually impact patient care for the better, but still remaining clinically sharp and being able to speak with those in the trenches. For me, it's a really great workplace mix.
So I was a lead PA, I don't know, a year or two. We had 10 PAs at that time. Now there's, I don't know, gobsmacked. There's tons of them. But in my time in that leadership role, basically the PA leader was the PA manager. It was a synonymous thing. And I didn't like managing people. I like having the idea that, yeah, I'm going to help make some decisions. I'm going to help contribute this way or that way. But when it comes down to doing schedules and dealing with complaints, being like the person, the docs complained to me about the PAs complained to me about the docs, that wasn't fun. I didn't like that. I didn't enjoy that part of it at all. How do you incorporate that? I mean, is that part of the deal? Is that just part of the being the leader, or does it just depend on where you are? What do you think about that? And I'll put that out to everybody.
I would agree that the people management aspect of the position is the hardest part and the steepest learning curve. As you mentioned, everyone's going to come to you to complain. This is very true. And there are strategies and ways for you to digest those complaints, understand their validity, communicate solidarity, also triage whether or not something needs to happen out of this complaint, or simply act as a sounding board. I was fortunate enough to go through extensive leadership training with my first promotion. And I don't know if that always happens in other institutions, especially private practice, that's going to be smaller. Like my leadership training was university wide. And without that training, I could see being very miserable very quickly in a leadership role. So it's possible. It's the steepest learning curve when you go in. And quite frankly, it's not for everybody.
Yeah, I think when I realized I enjoyed leadership, my last two positions I've been lucky enough to be kind of the lead APP was, as Amanda mentioned and Sam mentioned, when people would come to me regarding complaints, my first thought process was, how can I use this complaint and how can I fix this problem? And I think that's, when I kind of said, hey, maybe this is something I'm interested in and like to do, is I didn't find the annoyance of the complaint. I found the, how can I use this complaint to make things better and to make changes? And can I then adjust processes to improve so we don't get this complaint again? And I think, as Amanda said, that's definitely a mind frame you have to have as a leader. And it's something that can be taught and can be learned for sure.
I'm glad that we have people that are interested in leadership, and I'm interested in leadership. Obviously, with the PAOS and stuff, interested in helping and doing it. But man, that management part, people coming and complaining. And then the other thing was, and this is maybe different with academic, but somebody calls out sick, you can't find somebody to fill it. Well, you were expected to fill that. None of that was appealing to me. I didn't enjoy it. So maybe I should add some of that training. That might have helped too. Why is it important for PAs to understand the financial and operations language of administration?
I think it's important for PAs to understand where they fit into the care model of the organization that they are a part of. School is, rightly so, very, very patient focused. We are there to learn medicine, to become providers. And becoming a well rounded provider is much more than patient care and ensuring your diagnoses are accurate and you read your x-rays properly, everything that comes along with that. We are ultimately employees, and it doesn't matter what industry you're in, you should understand where you fit into the realm of your company. And that includes understanding the business aspect and the priorities of that company. I especially say this to new grads that are very focused on direct patient care, as they rightly should be. However, it's important with your first, I like to kind of call it grown up job, because most of us have been primarily students leading up until that moment, to think of yourself as an asset, because you are an asset to your company. And it's important that you understand how your company values you as an asset and what those figures truly look like, because it's much more than direct patient care.
I think, as she said, that's a huge thing. As a new provider, the focus is always on patient care and understanding your orthopedic and knowledge and experience. But, I think as you grow as a provider, learning the operational component of the clinic and how that works is definitely makes you a better provider to treat the patient as a whole.
Do you let Dr. Arrington teach your PA fellows?
Yes. Yes, we do. We unleash him fully to the public.
I know exactly what that laugh means. He had me for 4 weeks at Madigan during my PA training, and I'm jealous of your fellows that they get to spend a year around him. He is a vibrant character and will train you well, but also scare you at times.
He very recently won essentially the award of like the resident's favorite preceptor.
I know exactly why.
Yes. Yeah, he's a great character and a wonderful educator.
Thank you so much for being on the podcast today and talking about fellowship programs and some of the business aspects of being an orthopedic PA and leadership roles. Covered a lot of topics there. So, any parting thoughts you'd like to share with our listeners?
Absolutely. Thank you for having me. This was really wonderful. I've been looking forward to it for the past month or so. And I just want people out there to know PAs can wear many hats. We are versatile in that we come out of school and can work in the subspecialty of our choice. And we have so many possibilities as far as leadership, informatics, education. I myself remember speaking to my advisor in PA school towards the end when they were asking, okay, what subspecialty are you thinking about? And quite frankly, a certain body system didn't jump out to me at that time, but I remember turning to them and saying, I'm going to do something weird with this degree. You wait and see. And it has so much versatility, our education. And I hope the conversation today will inspire those to think outside the box about what they want to do with their PA skills.
Well, that's great. Amanda, thank you so much for being on today and look forward to talking to you some more in the future.
Great. Thanks, everyone. Good to meet y'all.
I hope to see you guys in Las Vegas. We're really looking forward to a big meeting and we've got a lot of good stuff going. So please check out our website and check your social media for details. Okay, thanks a lot and we'll be back next week.